So there's no one factor that'll determine whether somebody develops an addiction or not. The three main buckets of factors that we think about are environmental factors, genetic predisposition, so your genes, and then intermediate phenotype, which in this case means your specific brain. Starting with environmental factors, whether or not you're born into a family where there's drug use or trauma, or if there's other kinds of abuse in that family, or if you happen to go to the Vietnam War as a soldier or be born into Ukraine at this point in time, there's environmental factors and triggers that can make you more prone to develop an addiction later in life. And then these environmental factors, which can also be protective, it can be a great role model in your life, are then going to interact with your genes. And so there's genes that are strong predictors of developing an addiction. By themselves, they're not going to develop an addiction, but it's how they interact with your environmental factors as well as your intermediate phenotype or your brain in a way. And so some people, absent of these genes that determine addiction, some people just have personalities that are more prone to seeking novelties, or some brains that are just much more impulsive than others or have difficulty self-regulating. And it's the way that these three things, our specific brains, our specific genes, and then the environmental factors around this, it's the way that they interact that really determine whether or not somebody's going to develop an addiction. So speaking more to the environmental pieces, this is ACEs, which stands for Adverse Childhood Experiences. And they're really a major determinant of developing an addiction. And unfortunately, it's something that's not well enough understood by most people, I would say. And there's three main categories you can think of as an adverse childhood experience. The first would be abuse. So whether you're the direct victim of physical or sexual or emotional abuse, whether you're the victim of neglect, emotional neglect as an example, or whether you were raised in a household where there's dysfunction, which could both directly and indirectly affect you. And so, for example, if you had a parent who's incarcerated, or a parent who had mental illness, or a parent who was using drugs, all of these are actually incredibly strong predictors. Not alone, they won't determine it, but they can make you much more prone to develop an addiction. And just as an example, if you have 4 or more of these adverse childhood experiences, you're actually 10 times more likely to be a person who injects drugs as an adult. And I think the point I want to make here is that, unfortunately, we often think of addiction in adults, but a lot of the factors that have put addiction into play for somebody, unfortunately, have started when they're children, way before they're actually able to make any adult decisions. So what I want to talk about here is a neurotransmitter called dopamine. Dopamine is known as the reward neurotransmitter. And not everybody realizes, I think, is that dopamine is healthy and normal response to good things in our life. And so it's helped us to evolve as human beings. It helps us stay alive. And so what you see here is that you have most people have a baseline of about 100 units of dopamine. And then when you eat a delicious food, in this case it's a strawberry, you'll have a spike in dopamine and a feeling of reward, and then you return to baseline. Now what happens with that is when you get that spike of dopamine, you both get a feeling of reward and sort of feeling good, but it also triggers some memory formation. So your mind starts to think about all the things that led to you finding and eating this strawberry. And so you might remember, I found that strawberry by a river, and I found that strawberry on a clear sunny day. And so when you come across another clear sunny day and you're close to a river, you might say, this is a good time to look for strawberries. And so you both get a feeling of reward, but then you also search back, and dopamine really becomes this piece of learning. And you think about all the things that were associated with that feeling of reward beforehand, so that when you come across them again, you're going to think about looking for those strawberries and getting that feeling of reward that you got. So what we see in this slide is that, unfortunately, drugs can hijack this level of dopamine. And so if you look at the far left hand of the slide, things like food or sex, which helps us to procreate and our genes to live on in time, are like very small orders of magnitude compared to what you might get with using methamphetamine or heroin. And what you can see is from methamphetamine or heroin or prescription opioids or cocaine, you get these huge levels of dopamine far and above that you might experience if you just have sex or food, which are in many cases are really the great rewards that we have in life. But our brains are always seeking balance, or in scientific words, homeostasis. And so if we keep on experiencing super high levels of dopamine and reward, it can throw us out of balance. And so our body has all these very sophisticated and complex ways for us to achieve balance. And one of the ways that we do this, if you're consistently using drugs and getting very high dopamine levels, is your body tries to respond to sort of keep a normal balance. When dopamine, in order to give that effect and that feeling of reward and the memory stuff that we'd spoken about, dopamine needs to hit a receptor on a cell, which then triggers that whole response. And so one of the things that the brain does to try to achieve normalcy when there's high levels of dopamine happening all the time is it actually down-regulates its number of receptors. And so you might have the same amount of dopamine that's released, but if it can't hit the receptor and trigger that response within the cell, you don't get the same feeling and the same response from it. And on the right-hand side of the slide, what you'll see is there's a couple other mechanisms that we have. So we actually decrease the amount of dopamine that's released, and the dopamine that is released actually gets degraded and broken up quicker. And this is all the body's very intelligent way to maintain normalcy and balance. But the consequence that we can see here is that when you continue to use drugs or anything that releases this very high levels of dopamine, your body starts to downregulate the receptors. And so each time that you use, the level of dopamine that you receive is actually lower and lower and lower. And then also consequently, when you're not using, your baseline or your sort of normal level of dopamine becomes lower and lower and lower. And so people who use drugs frequently will tell you that the things that used to bring you joy or used to bring you the sense of reward, whether it's family or church or feeling good being around family or delicious foods, don't give you that same level of reward anymore. And so what people do is they often will sort of search back for that feeling of reward, which only comes from drugs. But over time, that feeling of reward becomes lower and lower and lower, and then sort of the normal and the baseline becomes a sort of lower and lower depressed place of being. And another unfortunate function that dopamine has here is when we look at just a map of the brain, what you can see is in the sort of center of the brain, and the lower center of the brain is the dopamine center, the ventral tegmental area. And what happens is the dopamine is released there, and what you can see that there's these neurons and projections that then go to the front of your brain, the prefrontal cortex, the decision-making part, and actually interrupt that area and sort of override that area. And so when you hear about, drugs hijacking the brain or the dopamine hijacking the brain, what's actually happening is when we get this cue, when we see something that reminds us of using drugs, or when somebody uses drugs, huge amounts of dopamine are released. It actually projects to the part of your brain that can usually make good rational decisions. To say things like, I'm not going to use drugs because I'm hungry and I'm going to decide to eat food and get shelter instead. But instead of that actually happening, the dopamine will sort of project and override the parts of our brain that can make good decisions for us and help us stay alive. And so if you're ever wondering why somebody's choosing to use drugs rather than seeking shelter, or why they're not going to eat food but they're going to use drugs instead, it's because the part of the brain that usually is there to make those good decisions and sort of weigh the pros and cons of any decision that we come across in life is really being overwhelmed by this part of your brain that makes the dopamine and sort of has these memories and then is searching for this reward. So summarizing the changes in our brain chemistry that can come about from dopamine is that substance use disorders can lead to real structural and functional changes in the brain. And these changes impair our ability to make rational choices, even in the face of immense negative consequences. And so a person with addiction does have self-control, but what we really need to realize when we put ourselves in their shoes is that their ability to make good decisions for themselves are often being opposed by these incredibly powerful and often overpowering forces within their brain. And so I like this image of somebody pushing a boulder uphill as I try to put myself in somebody's shoes. What can seemingly be an easy decision to make, forego drug use so that you can be with family and have a good meal and shelter, even a simple decision like that can often feel like you're pushing against this incredibly large boulder up a really steep hill. So we've spoken about the dopamine system within the brain, and now I want to talk a little about the opioid system, which is very analogous to what we talked about with dopamine. And so when you use heroin or prescription opioids, the common thing is that the drug will hit a receptor and then the cell will give this feeling of euphoria or pain relief or emotional well-being. What happens though is when you use consistently over time, similar to dopamine, your body wants to seek balance, and so it actually lowers the level of receptors so you won't get the same amount of effect. And so what can happen is this idea of tolerance, and tolerance being that you continue to use the same amount of opioids, but you get less and less of effect because there's less and less receptors for the opioid to bind to and give you that feeling. In the case of opioids, where it's a sedative or something that slows you down in a way, another way that your body seeks to sort of maintain balance is to increase the function of other parts of your nervous system that make you more alert. And so what can happen is both that you develop tolerance when you use opioids, where you get less and less of the effect that you're seeking, but also when you're not using opioids, that other sort of more stimulant part of our body that is sort of turned on to counteract the opioids. When the opioids are gone, then that part of our body stands by itself. And people can feel the symptoms of withdrawal, and that looks like they're almost hyperactive. They can't sit still. They're sweating, their pupils are dilated, their heart is beating very fast. And that's how people experience opioid withdrawal. And so what we're left with in this graph is really the unfortunate trajectory of opioid dependence. And so starting at the left, when people use, they initially get that feeling of euphoria when they use heroin. But as the receptors are broken down and downregulated, each time that they use, they feel less and less euphoria. And then what happens over time, their baseline becomes lower and lower and lower, partially because we have these endogenous or endorphins, or our body makes their own sort of things like morphine and to give us sort of joy and pleasure as well. And so those might exist in the same amount of level, but the receptors that they bind to get downregulated and less. And so what happens over time is both that you don't get the euphoric feeling of using drugs, but also that normal becomes lower and lower. And as we build up tolerance, when we don't have opioids in our systems, rather than just sort of feeling normal, we also start to develop this withdrawal. And as we progress through this side, what we see is this unfortunate but really common story that you'll meet with people who are addicted, where they're not using to get high anymore, but people are just using to get normal, or feel normal and back to their baseline. And unfortunately, when they're not using, they're in withdrawal. And so it's a common story for people who've used opioids for a long time. They're not actually seeking high anymore. They're just seeking normalcy. And so this is where medications for opioid use disorder, or MOUD, can come in. And so when we meet somebody and they're in this place of just trying to seek normalcy, drugs like oxycodone or heroin or fentanyl sort of are short acting, and you get this up and down feeling, and up and down feeling, and up and down feeling. And we use things like buprenorphine or the brand name Suboxone or methadone, these very long acting opioids. And so when we find the right dose, people are just in this normalcy place. And so the up and down and the withdrawal state that people have been in for a long time, they can finally find this balanced place. So this is a slide of what we're looking for in terms of the right dose when we have people on methadone or Suboxone. And it can take a little while to achieve, but we're using these medications that last a really long time. And so they come up slowly and they go down slowly, but they're always staying within that realm of normalcy. And so we're choosing a dose that's not too high, so we don't want people to have these over-medication symptoms of sort of nodding off or being too tired. And we don't want a dose that's too low so that people are still having withdrawal symptoms or cravings to use. We're really searching for is that sort of normal, balanced level that they can have every day, in and out. And ideally, as they do this, they'll have less urges to use drugs, and as they use drugs less and less, we can start to normalize that dopamine system in their body. And so things like spending quality time with family, or being with a loved one, or having a good meal, or sleeping in a warm bed, can start to give you normal and healthy levels of reward and dopamine again. And the benefit of normalcy and of feeling well leads to less drug use. And then consequently, when people are using less drugs, as they do run on these medications, there's huge decreases in mortality. And we could put similar graphs for things like risks of HIV infection and risks of hepatitis C. But I think the single most important thing is we want to keep people alive. These are family members, these are friends, these are community members. And what you can see from this slide is, in the green is just the general population who doesn't use drugs. And the red is people who are using opioids but aren't on treatment. So they're 6 times more likely to die, which is a huge risk of death. What you see is if we start people on medications, whether it's buprenorphine or Suboxone or methadone, we can bring it down to that line in blue, which really closely approaches the rate of death for the general population. And so these are incredibly effective medications that keep keeping people alive. We think about all these, fancy procedures and very complex medical things that we have throughout medicine right now, but there's very few things in any area of medicine and overall that have the effect of saving lives like medications for opioid use disorder do. So I want to take a moment to contrast medications for opioid use disorder like methadone and buprenorphine with detox. This is something that I've learned, as I've gone through my career, where, detox would be this short course of treatment, 5 to 7 days to manage people's acute withdrawal and intoxication. And I think there's a lot of people who believe if we can just get people through that 5 to 7 days, that they'll then be good. Unfortunately, we've learned that that's just not the case. While they might not have the acute withdrawal symptoms after those 5 days, in most cases, like the vast majority of cases, they will recur and return to use. Way over 90% of people who go through detox without our medications on the other side of it are going to relapse. And unfortunately, when they relapse, they might go a few days without using and their tolerance will go down. And especially in this age of fentanyl, when people relapse and they're not on medications like methadone or buprenorphine, the rate of overdose is so high. And so I think as a well-meaning thing from a lot of people in the community, if we can get you past this 5 or 6 days, you'll then be on your own, you'll be good. What often happens is the things that contributed to their ongoing addiction, whether it was their mental health that was untreated or their unstable housing or dysfunctional relationships or lack of purpose in their life, all those things are still there 5 or 7 days later. And that's where really medications like buprenorphine and methadone, especially in this age of fentanyl, become so important. Which isn't to say that everyone needs to be on these for the rest of their life, but at least if you can be on these for 6 or 12 months, and for some people much longer, what can happen is you can start to stabilize, and those things in your life that have been there for a long time, you can start to work on. You can start to rebuild your relationships. You can start to find purpose in your life. You can start to just enjoy the simple things in your life which you haven't been able to enjoy for a long time because things like a delicious meal or going to church with your family on Sundays didn't give you that same level of reward as it does in a natural state of being. So these medications which can really help sort of balance your life out so you can really start rebuilding the life that you want to live.